Welcome to this edition of the LucidQuest Rare Diseases Strategic Roundup, covering developments from 8 July to 12 August 2026. The defining story of this reporting period is that rare disease value creation is becoming more selective. Strategic attention is concentrating around assets that combine biological precision, credible development maturity, and infrastructure capable of accelerating them. The market is not retreating from innovation. Instead, competition is moving beyond the molecule itself toward the quality of the development system surrounding it. 4 themes stood out. The first was a shift toward strategic adjacency and risk control in business development. Recent transactions involving Jazz and Actio, Ipsen and Memo Therapeutics, and Mereo and Sentinel suggest that buyers are placing greater emphasis on assets that complement existing disease expertise, clinical networks, or commercial capabilities. For executives, the implication is that portfolio fit may increasingly matter as much as pipeline breadth, particularly when existing infrastructure can accelerate development. But strategic fit cannot compensate for weak clinical performance. Differentiated and approvable evidence remains the critical test. A second theme was the rising competitive importance of precision biology. Programs targeting KCNT1-driven epilepsy and DUX4 biology in FSHD illustrate the movement toward interventions closer to causal disease mechanisms. This may strengthen patient selection and mechanistic differentiation while increasing competition across therapeutic modalities. Platform technologies could also become more strategically relevant if validation in one genetically defined disease can support expansion into others. The uncertainty is whether mechanistic precision translates into superior clinical value once durability, safety, manufacturability, treatment burden, and cost are considered. The third theme was the growing role of patient networks and real-world data as development infrastructure. NORD's expansion of its Centers of Excellence network and the Angelman Syndrome Foundation's partnership with Citizen Health highlight how care networks and longitudinal data can support recruitment, natural history research, evidence generation, and commercialization. For developers, understanding the patient journey may increasingly become a competitive capability. But the value of these ecosystems will depend on interoperability, consent, standardization, and regulatory acceptance. The final theme involved market access. NORD's concerns around Medicaid work requirement implementation illustrate how coverage and eligibility processes can create friction for already small patient populations. This highlights a broader challenge. Scientific precision is advancing faster than some of the administrative systems responsible for delivering treatment. Commercial strategy therefore increasingly extends beyond approval to diagnosis, coding, referral pathways, patient support, and payer processes. The impact remains uncertain as implementation, exemptions, and state-level execution evolve. Looking ahead, we will be watching for further adjacency-driven transactions, clinical validation of mechanism-specific therapies, and expansion of patient data ecosystems. We will also be monitoring regulatory acceptance of non-traditional evidence and whether access constraints limit the real-world reach of newly approved therapies. The key takeaway is that rare disease competitive advantage is becoming more integrated. The strongest positions may come not from the largest pipelines, but from combining differentiated science with the infrastructure required to generate credible evidence and move patients efficiently from diagnosis to treatment. Thank you for joining this edition of the LucidQuest Strategic Roundup. For more healthcare market intelligence and strategic analysis,